Now we are going to show the therapeutic part with a patient who supposedly has come to us with a herniated disc at L4-L5, which, as we remembered, has a characteristic pain in the entire anterior aspect of the thigh, the lateral face of the leg, and which radiates towards the back of the feet. The first thing, let's remember that the cordus or the sacrus, any of the two instruments that we are going to use, are designed to work fundamentally the relaxation of deep muscles or at the level of the fascia. As there are large amounts of muscle groups in these areas, it is necessary to relax approximately 4 muscle groups to allow cordus or sacrus to achieve their most powerful therapeutic effect. The first thing that I recommend you to do with these patients is to use the heat bags. That will cause a relaxation of the muscles, at least superficially. And this will lead to less treatment time, or less retention, or resistance to the action of cordus or sacrus. The first thing we are going to do is to remember that, if the hernia is in the lumbar region, my primary work area is going to be the lumbar region. I am going to place a towel on this area to be able to place superficial heat. And as a reflex zone, that will guarantee a relaxation of the entire musculature for integrity. We will work on the cervical area where tensions will also occur, as we had previously explained, on the interspinales and the spinous transverse muscles. For that we must place previously heated bags on the spine, at the level that covers part of the sacral region and part of the lumbar region, and another bag on the cervical region that covers the cervical region and part of the upper dorsal region, because they are the reflex points. And so the surface heat can be maintained for 10 minutes in this position by the patient, achieving a therapeutic and relaxing effect. Once the 10 minutes are over, we move on to remove the surface heat sources. And we will go directly to treat the patient in her herniated disc problem. As a rule, there are several ways to treat the patient, but I like one specifically, which is that once we have worked with surface heat and we have managed to relax the patient's surface muscles, we will now work directly with one of the devices. We can work with sacrus or we can work with cordus. And that depends on what each therapist looks for, and the desired therapeutic effect on the patient. As a general rule, as I said, I like to work with sacrus the first sessions or the first stage. Because remember that sacrus is fundamentally related to the specific changes of the sacral bone. And above all, it will serve to remove blockages or the problems of nutation or counternutation that the sacrum has, and at the same time, it will help me to work first on all the fascia. You know that the fascia is usually another pain driver system, apart from the central nervous system. But the fascia will also relate pains in an area with reflex contractions, from other areas of the body that sometimes have seemingly nothing to do by anatomy, with the region that I am going to deal with. In this patient's case, as I explained, she has a herniated disc in L4-L5, and once I put surface heat, I will work the first session with sacrus. So, this is what I am going to do with the patient. The first thing that I need to do is to place her with her legs bent at 45 degrees. In such a way that I can establish the lumbar lordosis again. And this will help me, from a biomechanical approach, to act upon the deep muscles. In the same way, I will have the cervical region, in which, to be able to work with the patient, I will place a folded towel in this area, so that she can rest. And this also will help to maintain the cervical lordosis. Considering that the patient achieved again a normal cervical lordosis and a lumbar lordosis, the dorsal kyphosis as well as the sacrum will both adopt the normal position. And this is already facilitating me, from a biomechanical approach, that the action of the sacrus, which is the device I am going to work with, is much more powerful. We must remember that, if I am working with sacrus, we must first work 3 basic points: cervical point, diaphragmatic point, and lumbar point. In this case, and since you already know from the previous videos how these areas are worked, I will obviate them. And I will eliminate the steps of working in the cervical region and in the region of the diaphragm. And I will go directly to work in the sacrum bone area. For this, we'll ask the patient to raise her hip. We locate the point, and place sacrus there, at the level of the coccyx. And ask the patient to descend slowly. To guarantee a greater therapeutic effect, we are going to place another towel under the lumbar zone. In such a way, that it helps to maintain a correct lumbar lordotic curvature. By doing this, we will keep the therapy session between 3 and 4 minutes. Now, if this patient came to me and radiologically I obtained and verified that she has a lateralized sacrum to the left. What we are talking about is a sacrum that is tilted in this way. That is, posterior inferior to the left side and rotated in this way. We will perform a basic maneuver, where I will take the patient's legs, and in this position, I will perform this movement. Right. Stretch. Left. Rotate. Flex. And back to the start. Now to make the action of sacrus more pronounced, I ask the patient to extend her legs and leave her like that for approximately 3 to 4 minutes. Once the 3 or 4 minutes are over, I flex the patient's legs again. I hold her at the level of the legs and her knees. And rotate again to the right side. Extend. Then rotate to the left side. Extend. And I ask the patient to raise her hips. And remove the sacrus. Well, let's remember that this patient has an 8 mm hernia, which is why I'm going to be able to work directly in that area. But, if this patient had a hernia bigger than 1 centimeter, I would no longer be able to work directly with cordus in the region of the hernia. I should work instead 3 centimeters above or 3 centimeters below it. As the patient is evolving over time, and I order new imaging studies to be performed, either a resonance or a tomography. And the study reports that, after having treated this patient with cordus, 3 centimeters above or below the hernia, for several months, or maybe about a month, or 2 months, we find it has reduced, and it's a size of less than 1 centimeter. That is 8 or 7 millimeters. And the hernia has descended. Then, in the next sessions after this study, I would begin to use cordus specifically in the area of the hernia. I also want to say that, especially in patients with very large herniated discs, those who have too much time evolving, we won't put cordus 3 centimeters away. It needs to be 9 or 10 centimeters above or below. And I will follow the evolution of these patients, with imaging studies every 3 months, and see how the size of the hernia has changed. And as the hernia is reducing, I start working at 3 centimeters, and when it goes smaller, then it's possible to work directly in the area. So, I will be changing the cordus depending on how the hernia size is modifying in that region. As I explained earlier, we are going to work based on the supposition that this patient we have here has a small herniated disc, approximately 8 mm, located at L4, L5. And now I'm going to work with cordus to achieve the biggest and most desired therapeutic effects in this patient. For that, we are going to use several therapeutic points. First, let's remember that there is a basic scheme when working with cordus. We start from the cervical region, going down to the dorsal region, and so on. As I previously described in other videos. Today, I will just explain the work in the lumbar zone. For that, I'm going to stop at 3 points where we'll apply the therapeutic effect. The first point I am going to work in is L1 L2. Always remembering that anatomically, L1 L2 will be aligned with the xiphoid process. We draw a vertical line downwards, and in this area, we will find L1 L2. We are going to ask the patient to raise her hips. Locate L1 L2, and place cordus in this region. And at the level of the sacrum, I will put a towel or a pillow. In such a way that it enables this region to rest. It facilitates the biomechanics of the spine. And does not cause any type of discomfort in the patient. So I'll treat her for 3 to 4 minutes. During these 3 or 4 minutes that the effect of cordus is being applied over the region of the L1 L2 vertebrae, I am going to ask the patient to raise her leg in this position. I am going to do an exaggerated dorsiflexion. And this, by means of reflex actions, will cause the muscles of the sacrum and lower lumbar area to relax, so that the action of cordus is much more effective. I do it for 30 seconds on one foot, and 30 seconds on the other. Always making sure for this, that the patella rests on one hand and the hand that performs the reflex action, rests on the plantar part of the foot. This will ensure that all the muscles that are inserted into the iliac crests, at the level of the sacrum, relax automatically. Now we are going to place cordus, specifically, as I said, in the sacral region. Because what I'm now looking for, is to relax all the muscles that are involved in the lumbar region. Now, we locate the iliac crest and the trochanter. And in the intermediate point between the iliac crest and the trochanter, is where the location of S1 S2 is going to be. I place cordus in that position. And then I let the patient descend slowly, to the point where she feels pressure. And I will then place a towel under the lumbar region, to maintain the curvature and avoid discomfort in the patient. In this way, I am achieving the therapeutic effect, and I ask her to extend her legs. If I want to further enhance the relaxing effect, then I can use several maneuvers, as explained before. One would be to bring the back of the foot in an exaggerated dorsiflexion. Or I can cause a flexion of the first joint with an extension of the rest of the joints. And by doing this, I will achieve a reflex effect where the muscles of the leg and the thigh are relaxed successively. And so the lumbar region. Or I can also use a patellar maneuver with taps in this region in such a way that creates a tension of the quadriceps. And the quadriceps relaxes the iliopsoas muscle in turn. Which, as I have explained before, the iliopsoas muscle is the one that helps when the patient is in the supine decubitus position. It is the one that helps to relax the muscles at the level of the lumbar region. As there is an alteration in the function of the circumflex nerve in the case of this patient, affecting the control of bladder or anal sphincters. Or there is an apparent compromise of either the sacrooccygeal muscle or, most probably, the pyramidal muscle. Then I will treat the patient in the sacrum-coccyx junction point. For that, I'm going to ask the patient to locate with her hand where the coccygeal process is. That is proximal to the anus. And there, with the help of the patient, I place the cordus device. I slowly let the patient descend on it. And I'm going to ask her to extend the extremities. Very specifically, there are maneuvers that we have to be very careful with. We have to especially take into account that when the X-ray is taken, or in the tomography, there are no alterations in the sacral iliac joint. But with this maneuver, we can even help the effect of cordus to be greater on this area. And the therapeutic reflex effect of relaxation in the area to be more specific. For that, we are going to use this hip maneuver, where we will locate the anterior superior iliac crests of both sides. And we will apply a small load of weight on the patient. And in this way we feel how her sacrooccygeal bone starts to align or is getting corrected. And then I'm going to place my thumbs on the lower anterior iliac crests, and the rest of the hand at the level of the trochanter. And I'm going to push very lightly. I will do this by dropping my body weight on the patient. And I'm going to perform this maneuver. In this way, I am facilitating the therapeutic action of cordus at this point, and achieving a bigger relaxation effect in the area. Having finished working in the sacral area, we will specifically focus attention and the work on the hernia. Remember, and I once again describe it, that it is an 8 mm hernia located in articulation L4-L5, for which I am going to place cordus in this place. I always like to do the following in the first sessions, while the patient is adapting. Remembering that the musculature should be progressively relaxing and adapting. And the vertebrae should also progressively take the correct biomechanical position. In the first sessions, we can place, so that no type of discomfort occurs, a towel on top of cordus, in such a way that it minimizes the contact between the cordus therapeutic processes and the region of the spine. For that we are going to start by placing the patient with her legs flexed. Recall that, anatomically, if we look for the iliac crests and draw a vertical line or a perpendicular one to the bed, we find that in that region you will find the L4 vertebra. Therefore, to treat the space between L4-L5, I will place it 1 cm below, 1 or 2 cm below. And I will be placing it there in space L4-L5, specifically where the hernia is. I'm going to ask the patient to raise her hips. I look for that point. I place the cordus here, specifically in this region, and slowly drop the position of the spine. If I want to decrease, as I said, the effect, I will place a towel over cordus. And in this way, the patient will relax, that is, I will avoid an annoying tension in the patient, and at the level of the sacrum, so that the therapeutic effect increases. I will place a cushion or towels. That allows her to rest that area. This way, we are achieving the therapeutic effect. The patient will stay in this position between 3 and 4 minutes. But the therapist can help even more, performing a specific maneuver for this type of a hernia. And for that, we are going to take the legs of our patient at a 90-degree angle. We can place our arm on both knees and press downwards, doing a lateralization towards the left side. We return to the basic position. Another lateralization towards the right side. And we make a circling maneuver to reposition the patient at 45 degrees in the position of the lower limbs. Once we have also proceeded with the therapy to reduce the hernia, and the patient has not reported any pain, we can finish the treatment in 3 or 4 minutes. We remove the sacral support. We ask the patient to raise her hip. And we remove cordus as well. If we are dealing with a central hernia, we can do the following. We ask the patient to flex a leg as much as she can, doing it on her own, all the way to the abdomen. Hold there for 3 seconds, and flex the neck. And then repeat it with the other leg. This is in the case of a central hernia. If it were a lateralized hernia, and in this case, it was lateralized to the right side, and the right side is the only one presenting the sensation of sciatica, We can tell her to flex her leg in the same way, towards the abdomen. But her left hand is the one that is going to be placed on the knee. She will press her knee while bending the neck. In this way, she is achieving a rotation and a possible reduction of the hernia, facilitating its regression. We can also combine this with other exercises. In this case, we'll perform Williams exercises. For this, we'll ask the patient to stay in this position. And I should add that this can be done in patients with a lateralized or central hernia. It does not matter. Let's do the following exercises. Bring the arm towards the back, while stretching the opposite leg. Keep it that way for about 10 seconds. And then exchange. And perform the exercise with the affected leg and the opposite arm. This can be done in 5 to 8 repetitions. Once the therapy with CORDUS is finished, and we recommend the patient to do this type of exercise several times at home. And also, if the patient has acquired CORDUS and she has it at home, not on the same day that the therapy was performed, but in the following days, she can use CORDUS on herself and perform these exercises later. In this way, it will progressively contribute to reducing the hernia. And if it's not reduced, the patient can, as well, start re-educating the lumbar region and achieve stability and adequate biomechanics, so that the hernia does not progress, and subsequently, avoid receiving another type of treatments, or even a surgical intervention. The main objective here is to avoid surgery, and achieve greater stability in the patient, and to keep this as long as possible without pain or discomfort caused by the hernia.